Hello everybody, I'm Grant Boxleitner. Welcome to Local Doctors on Call. I'm joined by Dr. Stephen Wrench and Dr. Brandon Fuller of East West College of Natural Medicine. Gentlemen, welcome. And in this first segment, I want to talk about choosing Oriental medicine for trauma. And so I just want to know for patients, how do you know whether to go to a Western medical doctor or an Oriental medical doctor? What's the difference and how do you make that decision?
Well, I think generally the first thing we would think about is how painful is it? Let's take a scenario. You sprain your ankle. You can't bear weight on it. Right. You can't walk on it. I think that's pretty much a no-brainer. We do the same thing. We would probably check ourselves into Sarasota Memorial and get some imaging work done to find out, do we have a fracture? Do we have a sprain? If so, what the severity of the sprain is. So I think one of the things we would go by is the pain level. The second thing is, have we lost range of motion? You know, how debilitating the injury is. I think you know that. And if it's not a trauma, if it's just like, let's say I have abdominal pain, I think the severity is really the number one factor. Remember we talked about before, your body communicates with you three ways. Right. How you feel, and by form, changes in physical form and function. So I think most of the time we know. Sometimes you could certainly have a minor injury, not know it. Yeah. And you're walking on an ankle that actually has a hairline fracture and things like that. We say when in doubt, get some image work.
So as far as the Oriental medical doctor scenario, give us a couple of instances or examples when that would be appropriate.
So as we know, there's the Olympics going on, right? And for those who are athletes, sometimes they go running and they hurt afterwards, they ache afterwards, sometimes they might have a mild sprain or strain. That's when they can come to us and we can work with them, do some orthopedic evaluations, figure out if they need to go get imaging. Right. If they don't, then they can get some acupuncture or some herbs or something to help ease that healing and make it a little bit faster for them.
Yeah, absolutely. And is it mostly preventative, or do you also treat serious conditions?
It's actually both, Grant. It's a cultural thing where this medicine actually originates, of course, in China. Right. Thousands and thousands of years ago. It was used as a preventative measure. Mm-hmm. But we're of a mindset in this country to, I'll go to the doctor when it gets bad enough. And we're all too guilty of waiting sometimes, putting things off and waiting.
The pain is so bad where you feel like you definitely have to take action.
Exactly. So for us, we think of preventative medicine, I think, in this country as, well, I exercise and I eat right, and I get plenty of rest, so that's my preventative. And perhaps at another time, we will talk about how this works as a preventative measure, but it certainly is both, before and after the fact.
Yeah, and Dr. Fuller, anything you'd like to add on that?
Definitely, with the traumatic injuries, we can do preventative work, specifically also after somebody's had a traumatic injury and needed to go to the emergency room. So think of a heart attack per se, and they had to have open heart surgery. They can come to us afterwards and we can do acupuncture to help the body heal and then help with preventative measures for later on down the road.
Augmenting the other protocols.
Exactly.
That's correct.
Yeah.
I see. All right, so what are the different types of treatments you can do for somebody when we're talking about a traumatic event? You just mentioned one of them.
Well, I think one of the things we would do, certainly is because it's kind of in our name, is acupuncture. Right. And we would treat specifically for points that are correct for that particular trauma. As Dr. Fuller mentioned earlier, we can speed up the healing process to some degree. Okay. And that's why you're seeing more and more athletes get this, because their livelihood and their career are one and the same. So these guys, if they can't get on the field, they can't play. And so their career's affected. In fact, if I may, everyone's buzzing about Michael Phelps and what a great job he's doing.
And we're certainly going to get into that in the next segment. We're going to talk all about cupping therapy.
Okay. Well, just because they're out there in the limelight, you're seeing athletes, you're seeing actors, you're seeing famous people having these treatments, and everybody goes, wow, guess who's getting acupuncture now? Most of these people have been doing it forever because they're big believers in it.
So it spreads word of mouth, and then all of a sudden...
But you know, again, when people say that, well, that's news to me, we say, well, it shouldn't be. It's been around for 6,000 years. Right. So, whether or not you've had an experience with it, it's an individual thing, but we just say it's been around forever, and we will talk about that a little bit more.
Yes, looking forward to that. And don't go away. More Local Doctors on Call right after this.